Hey guys, this is Samantha Frontera. I'm so excited because we have our second podcast series of the Doctor Series. And I'm really stoked because we have a beautiful, amazing doctor who's on our show today, Dr. Richmond from Houston, Texas. And she also is a former Chicago native. She has her own practice called Your Total Health. And she's going to be talking to us about all things healthcare today and empowering women in healthcare. So thank you so much for coming on the show today.
Well, thank you so much for having me, Samantha. I appreciate you all realizing the need to talk about health and women's health and having me on the show.
Yeah, absolutely. So we're going to just jump in, and I want you to share a little bit about your background and tell us why you became a doctor and your specialty.
Okay, so a little bit about my background. Again, I'm Dr. Taria Richmond. I'm also known as your total health doctor. I'm a board certified family medicine physician, but most of my focus for just natural reasons is in women's health. And so I do everything from chronic disease prevention and management to the well woman examination, some depression, anxiety management, and I believe in helping the total woman. And I'm from Chicago, as you said, and I went to a high school called Whitney Young High School, which is actually the
Mhm.
same high school as Michelle Obama. So I always love to tout that. Not at the same time, but we both have the same alma mater. And I studied medicine at the University of Illinois as well as public health at UIC. And then I moved to Houston to do my family medicine residency at Baylor College of Medicine in the Department of Community and Family Medicine. Then I went on and worked in the county system here in Houston for a little over 8 years and finally decided to take the leap actually take the leap 3 years ago and join a group in private practice and then take the jump into my own private practice as of January this year.
That's amazing, and congratulations on that. That is a huge step, but that's
Thank
that's
you.
phenomenal. That's phenomenal, and I definitely feel like you're a huge inspiration for women, and I love the fact that you are inspiring so many. Can you tell us a little bit more about some of the health tips that you put on your Instagram? You know, I do follow you, and I see on Tuesdays that you put health tips, and some of
Yes.
them are geared towards mental health, specifically. What's been going on with COVID. Can you tell us maybe some top three health tips that you've been giving your audience on Instagram so that we can know a little bit more how to better our own health?
Absolutely. And I do want to say this, and it'll tie into that question. You asked, why did I go into medicine? Why did I want to be a doctor? And I want to definitely address that. So initially, I did not realize that I wanted to be a doctor as like a little kid. It wasn't until I saw my own family doctor, my own adolescent health doctor, who wanted to talk to me directly as a minor about my health concerns, my health issues without my mother in the room. And when my doctor at that time told my mom, okay, you have to leave the room. She's my patient. I thought, okay, I love this. I love what she's doing. And then also I grew up on the west side of Chicago where I saw a lot of teen pregnancy and also lots of like sexually transmitted infections and things like that. And so both of those married together. And that's why I wanted to go into medicine. And with that being said, also to promote health and be use my platform to share health tips. So, three top health tips right now in this moment. Particularly, we have so much going on right now that coronavirus seems to have been put on the back burner. So, my first health tip, especially if your city has opened back up and you're out and about in the community, is to wear your mask and physical distance. That is still really a real concern that you could contract coronavirus. So, one is wear your mask and physical distance. Two is don't forget, just like you and I are interviewing today, Samantha, there is an option for telemedicine so you can see your doctor online. So don't forget to still make your appointments and follow up with your doctor. So that's going to be health tip number two. And then my third health tip is going to be self care. So that means taking care of yourself, whether that means getting 8 hours of sleep, whether it means exercising, whether it means eating more healthy or drinking more water. My third health tip would be to make sure that you exercise self-care in this time.
Yeah, absolutely. Those are great, and I definitely agree with all of those tips. And I think self-care is really important, specifically the fact that coronavirus is definitely still a great possibility that people can contract it who haven't already had it. And now that cities are opening back up, and you're allowed to, in Chicago, you're allowed to dine on patios. Your waitress has to wear a shield, but you don't have to necessarily always wear your
Mm.
mask at specific restaurants in the city. So I think that telling people to wear their masks, at all times, and maybe just putting it down when you're drinking or eating, and then still social distancing with your peers, I think that's really, really great advice. You mentioned about the telemedicine, and that was going to be one of my other questions that I wanted to ask you today, which was, I think telemedicine has become much more popular. I also learned that my own health insurance is covering copays for telemedicine, because I was
Mhm,
asking my
mhm.
doctor, I haven't received a bill. Am I going to be receiving a bill? And they were saying that some insurances have decided for the end of the year to cover copays for telemedicine. And I do believe that that's amazing. I know that you offer telemedicine and you promoted that on your Instagram. Can you share a bit more about that experience if someone hasn't done a telemedicine visit yet?
So if you haven't done a telemedicine visit yet, the most important thing is that you're prepared. So if you're calling in for a concern, let's say it's a problem like your blood pressure, you should have a blood pressure cuff or go to your local store or pharmacy to get your blood pressure checked, of course still wearing your mask, so that you can present that to the doctor. So you want to be prepared if you have questions. And basically, it's very much like this. It's could be on a Zoom Health platform, but there's HIPAA compliant platforms where you either click on a link or you dial in from your phone. You pop up on the screen. Your doctor pops up on the screen. It is history and physical, as for as much as we can do online, and then we can actually send your medications electronically. And in this time of COVID, I actually worked previously for a an online telemedicine company, so I kind of had an idea of what it entails. But you certainly can get your prescription sent in, which we recommend that you make sure that you have your medications. And I've also worked on a pilot where we do telecontraception, where we're able to offer birth control online, as well as HIV prevention with the medication that we term PrEP, as also online telemedicine option as well.
That's great. And in terms of women's healthcare and how it's changed drastically due to COVID, what has just really been your experience, and how are you helping some of your female patients through that experience?
So through this experience of COVID, of course, if there are wellness concerns, so if we're planning to get your Pap smear during COVID, we have postponed those because it's more of a wellness examination. But if you're having urinary symptoms, meaning you're having problems when you pee, if you're having vaginal symptoms, we can people don't know this, but medicine a long time ago, we didn't have all of these different tests. What you had to do was listen to the patient, do a physical exam for as much as you can, and come up with an assessment and a plan. So it's very much like that. So you may not necessarily be able to get a test, but based off of what you're telling us for your women health concerns, we certainly can treat. And it's almost like a diagnostic where if we treat it and it gets better, then we know that that's what the issue was. There are some circumstances where we have to have you come in, to be assessed, and we have to, of course, wear our protective equipment to do those examinations. But those are if it's really, really urgent or it's something that could be life-threatening.
Right. In your professional opinion, due to the fact that a lot of places are starting to open back up, just again, in your own professional opinion, do you feel like we will see a spike in COVID cases? And how does your practice handle that?
So absolutely. So, looking at the trends and looking at the science, that's certainly what I have been doing. Anytime that we have a large gathering of people, particularly with they're not wearing their mask or they're not physically distancing, that is an opportunity for the virus to spread. And I was just thinking the other day, we always have, something going on that causes people to gather together. And so we may see a spike again. We're predicting that possibly in the late fall or winter, and it's something that we know could potentially happen because we see it with the flu virus.
Yes, definitely. And if you can kind of share a little bit more about your service line and the services that you offer at your practice.
Absolutely. So, in this time, of course, we've been doing telemedicine. And if there is, again, if there's a spike of coronavirus that occurs, we will pivot and adapt and potentially go back to more telemedicine. I don't think that telemedicine is going to go anywhere. But again, in my practice, I do. Chronic disease prevention and management. I do pap smears, woman examinations where we do the full physical, the regular annual physical, labs where we check in general. I always check a HIV test for everyone 13 to 65 because it's recommended by the CDC. Labs for your cholesterol, checking your kidneys, your liver, and then any health maintenance that's recommended by the CDC, given your age and your cycle in life. For example, the mammogram, and ordering that and making sure that all of those things are up to date as well. So we do the whole gamut. We are a one-stop clinic. I won't say shop, one-stop clinic.
Yes, and is that where you came up with the name for your practice? Like, where did you come up with the name?
Yes, so your total health doctor is kind of my brand, my kind of tagline, and I have a phenomenal mastermind group, and they were talking to me and saying, "Okay, what do you want? What is your thought about medicine? What's your philosophy?" And I believe that medicine is the mind, the body, and the spirit, and if you don't have one in order, then it's going to be hard to get the other things in order. And so they were like, "So you're really into like total health?" And I was like, "Exactly." I am your total health doctor. And
I love
it's
that
just
name.
stuck from there. Like people introduce me as your total health doctor. So
I think that's such a great name. And you were talking
thank
about
you.
some health tips earlier, and we talked a little bit about mental health and during this time. I know that you aren't specifically a doctor that just focuses on that, but do you have any other, perhaps tips to share with the audience today?
Oh, absolutely. And one will be, well, we certainly want you to watch the Doctor series, right? We want to also have limited exposure to social media, limited exposure to the news. It can be everything that we have going on right now is traumatizing in itself. Between coronavirus, police brutality, is so much going on right now. And the last thing you want to do is continue to expose yourself to traumatic stimuli day in and day out. We want to be informed, but we don't want to get overwhelmed with all the information and all the things that are going on in the world on a regular basis. So one way that I would say, and that is an action of self-care, is to step back from social media. What the second tip I would recommend is, if you're feeling like you just can't get out of it, or you need someone to talk to about, your mental health, and you're not just feeling well emotionally, what I would recommend is therapy. And the great part about that is that you can have access to therapy via telehealth as well. I believe in that so much that I have a behavioral health therapist in my practice as well.
Oh, that's wonderful. I love to hear that. That's great.
Yes,
And then my other couple last questions to wrap up this interview would be,
sure.
you're obviously a female doctor and also, basically inspiring women by being a female doctor. Can you share with us, if a woman wants to be in the medical field and perhaps a doctor herself, what are some encouraging or inspiring thoughts that you might tell that woman?
Yes. if I can do it, you can do it. I'm a little black girl from the west side in the Austin community. I grew up in a home with my mom. My dad was not in the home. She raised three of us, and you focus if you're focusing on your education, getting your grades, and doing things that show you have a heart of service. You can certainly get into medical school, and maybe not the first time. It's very competitive, but maybe the second time. And so don't give up. It is a work in progress at all times, because you have medical school, you'll have residency, you'll be a doctor at some point, but you certainly can do it. And don't be discouraged. Don't be discouraged. Hang in there. That first application may not be it. That first MCAT score may not be it. Just try it again. Pick it up and try it again. And it's doable.
And do you feel that we need more women who are in medicine who are specifically doctors?
100%. We are underrepresented, particularly if you're a woman, and then two, if you are a minority female, we are really underrepresented. And the study showed that when we go to medical school and we become doctors, that we actually go back to our communities and serve our communities, and it's so needed given all of the healthcare disparities in the African American and Latino community. And so I would say that absolutely we need more women in medicine. We need more women in medicine, and not just with um, uh, family medicine or primary care, OBGYN. We need surgeons. We need anesthesiologists. We need the whole range. So I would definitely encourage any young woman, or any woman for that matter. One of my classmates was a nurse for 20 years,
Mm-hmm.
and then she came back to medical school and finished medical school. She and her daughter graduated from college, and she graduated from medical school the same day. So the sky is the limit.
That's amazing. I love that. Well, tell us
Mhm.
where we can learn more about you or follow your social handles.
Absolutely. So you can follow me on Instagram at Dr. T Richmond. I'm also on Facebook as Dr. Taria Richmond. As you can see, my name is listed at the bottom of the screen, and it's listed just like that on Facebook.
Awesome. Well, thank you so much for your time today, and thank you for being a guest.
You too. Thank you so much for having me. I am delighted when I got the message. I was like, oh, that's so nice. So thank you so much. I'm
Yeah.
delighted to have been able to do this with you, and meet you as well.
Yes, thank you so much. Well, have a great day, and we look
Okay.
forward to talking to you again soon.
Okay. Take care.
You too.
Bye bye.